Now we are going to demonstrate this very particular procedure. Okay, and the procedure is oxygen administration. Okay, before we are going to discuss, before we are following the procedure, there are some instructions which we are keep in mind. And the first instruction is be sure that the client has no matches, or we can say cigarettes or any other smoking material. Okay. So this is the first instruction. Be sure that the client has no matches or cigarette or any other smoking material. Okay. And the second instruction is the warning sign. Now the second instruction is warning sign. वहाँ पे देखो warning sign. Attention, no smoking. And this should be posted behind the bed or it should be posted on the client's bed. Okay, this is the second instruction. Third instruction is don't use oil or oxygen cylinder. This one is oxygen cylinder. This one is oxygen cylinder.
Keep it on the left side. Keep it on the left side because the logger is kept on the right side, so you can keep it here.
Don't use oil on the oxygen cylinder. Why? Yes, exactly. Because oil can ignite. Because oil can ignite. This is one more.
Where exactly oil should not be applied? Please tell. Where you should not apply? Where you are not going to apply oxygen? The oil.
On the top of the cylinder.
Top of the cylinder means here.
Yes, sir.
Here also as well as here.
One more instruction is equipment जो हम use करेंगे that should be working properly. Okay. Maintain constant oxygen concentration according to doctor's order. Okay, this is one more instruction. Yeah, provide fluid mouth care to the patient. This is one more instruction. Yeah, discontinue भी करना है only after physician ordered. Okay, these were some instructions. First instruction was client has no matches or cigarette or any other smoking material. Second one was the warning sign should be posted on the behind the bed or it should be posted on the client's door. Okay, and the third one was don't use oil on the oxygen equipment because oil can ignite, and the tubing should be patent. Yeah, maintain constant oxygen concentration according to doctor's order. Okay, provide fluid mouth care and discontinue only after physician order. तब तक हमने discontinue नहीं करना है. So these were some instructions which we have to keep in mind. Now coming to procedure. तो प्रोसीजर में हमने क्या करना है? पहले check physician's order. Check physician's order. This is the first point. Second point is check physician's order. Check physician's order. Okay? Second point is take verbal consent from the patient. Take verbal consent from the patient. And the third point is take verbal consent of the patient. And the third point is assemble all articles required for the procedure. These are the articles which are required while providing oxygen therapy to the patient. This one is record chart. When we are providing oxygen therapy to the patient, after providing oxygen therapy, we have to document that procedure. Okay, this is a record chart, and this one is nasal mask. This one is nasal mask. I will show you after when we are giving procedure. This is nasal prongs. This is swab-stick clean nostrils. This is the surgical gloves. This is micropore adhesive cap. This is container. This is kidney tray. This is bowl with water in order to check the patency of the tube. This is also bowl which contains gauze pieces. This is a paper bag, and this is a tray. So these are the articles which are required for the procedure. These are the articles which are required for the procedure. Okay. तो उसके बाद हमने क्या करना है? Maintain privacy of the patient. First point was First point was check physician's order of the patient. Second point was take verbal consent of the patient. Third point was assemble all articles required for the. These are the articles which are required for procedure. Okay. And one more point is maintain privacy of the patient. Maintain privacy of the patient. Provide comfortable position to the patient. This is also important. And in this procedure, we have to provide semi-Fowler's, or we can say Fowler's position. This one is semi-Fowler's position. This one is semi-Fowler's. In semi-Fowler's position, the angle should be 45 degree. The angle should be 45 degree. And in Fowler's position, the angle should be 90 degree. उसके बाद हमने क्या करना है? Explain procedure to the patient. उसके बाद हमने क्या करना है? Explain procedure to the patient. उसके बाद hands को wash करना है and then gloves. Okay. Now we are going to following procedure.
Is it a clean procedure or a sterile procedure? So this is a sterile. This one is a sterile or a clean one? So you have wasted one sterile.
Now we are wearing gloves. Okay. Now we are following procedure. So after cannula with connecting tube, I will tell you. What is this? This one is nasal prong. This is not pipe. This one is nasal prong. This one is nasal prong. This one is nasal prong. This one is tubing, and this one is connector. This one is connector. Okay, we have to connect this connector in this humidifier. Okay, humidifier. Okay, when we are connecting with this.
He has filled water in the humidifier. Is it required to fill the humidifier with water? Which type of water we have to fill?
Distilled water.
Why water is filled in this humidifier? How it is going to help the patient?
In order to prevent the secretion of dryness.
To moist the oxygen, because oxygen is inhaled through the tube, so it has to pass through this water. Okay, when it passes through the water, it will humidify the oxygen also. Clear? So always daily you have to empty this bottle and you have to change the water. Adi, what is this? Come here. What is this? And this?
No meter.
Flow meter. ये मैम
Blow नहीं है, blow नहीं करेगा वो. Flow meter.
flow meter मैम this is regulator and this is
I have asked only this. And what is the purpose of this humidifier?
moisture मैम.
When this one is nasal prongus, when this one is connector, this connector is connected with the humidifier. After that, this is the nasal prong, and nasal prong should be inserted into the nostrils. Okay, and it should be placed behind the ear, and it should be placed behind the ear.
See this, see the face. No, it's okay.
And it should be placed behind the ear.
No, it has to be placed behind the ear, but it should be above the head, occiput, above the occiput,
It should
okay?
be placed behind the ear but above the head. Okay.
Otherwise, when the patient will lie down, he will not be comfortable as it can hit, okay?
After provide oxygen therapy, we have to maintain constant oxygen concentration.
And one more thing, before putting, those who are not interested, just move out. before putting this, you have to see the patient's nostrils also. If it is clogged with thick tenacious mucous membrane, so you have to put saline. Normally, this swab stick has to be dipped in normal saline and just clean it. Normal saline will help to bring out all the dry crust from the nose. Because if you are putting it like this with the crust, the oxygen will not pass properly. So that's why we should always, you have kept this swab stick, you have not mentioned what for you have kept it. So this is for this purpose. You have to clean it.
So before providing oxygen therapy to the patient, we have to clean the nostrils by means of this swab stick. Okay?
Don't put it dry. Where you will put normal saline. Not even in the tap water. Normal saline only.
Nostrils should be clean.
And your swab stick is, my God, such a big, that cotton will be stuck.
After cleaning the nostrils, we have to put this nasal prongus. We have to insert these nasal prongus into the nostrils, and the tubing should be placed behind the ear, above the head. Okay, and the oxygen concentration, we have to maintain a constant oxygen concentration until and unless the patient should be comfortable. Until and unless the patient should be comfortable. If the patient feels uncomfortable, we have to stop this oxygen therapy and inform the doctor. Okay. After that, when we provide oxygen therapy to the patient, we have to document what percentage of oxygen therapy we provide to the patient. So this was the nasal mask, or we can say nasal cannula. This was one thing.
So after putting the prong, you will start. You will start the regulator. So how you will know that?
Ma'am, we have to check this on the hand. We have to check this on the hand. Flu. After that, we have to put this nasal prongus into
You
the
have to
nostril.
explain that also, no? So one thing, when you are putting this, if you know that you are going to put the prongs, so before that, before putting into the nostril, you have to check whether the oxygen is coming or not. Not after putting it into the nostril. What I said. After putting it, don't try opening the regulator. Before putting into the nostril, you have to check it on the hand or in the water that the fluid is coming or not, the oxygen is coming in the or not. That everything has to be checked, and then only you have to put. So all these things you should know, because oxygen nowadays in the hospital, what type of oxygen cylinders you have seen? Central supply you have seen. Which color pipe? Yellow pipe. So in that, only you will find the humidifier, not the cylinder, nothing. Only the humidifier. You have to just clean it outside and take the bottle, wash it nicely, pour the solution. How much? Half only. Okay. And then you have to fix it. Then check the cannula, how the oxygen is coming, and regulation flow meter also you have to adjust. How much you have to adjust?
1 to 4 liters per minute. We have to adjust to oxygen concentration.
Certain patient will require less also, and certain will require more also. So most of the time doctors will write. Okay, so that also you have to find out. And as a new students, you should always ask the staff over there who's under whom the patient is, that how much liter of oxygen is going on, or how much has to be given to the patient. Clear? If it is not mentioned in the record. Okay. And then after cleaning
that,
and all this you have to do.
After that, we have to, when we provide constant oxygen therapy to the patient, so after that, when we have to discard this, we discard this, we stop this oxygen therapy according to doctor's order. Document
some patient, it will be like 2 hourly. 2 hourly for half hourly it will be given, or for 1 hour it will be given. But for certain patient it will be given continuously also. There are portable oxygen cylinders also nowadays. Patients are carrying home also. At home also, those patients who has to survive completely on oxygen therapy, they will carry a portable oxygen cylinders. But in the hospital, it depends upon the patient's condition. If they are asthmatic and how frequently the patient has to be given, that doctor will mention it. Okay. Got it? This is a very
After that-
important procedure.
After that, we have to remove this nasal prong. Okay, this was the procedure of nasal prong. Now we are discussing nasal mask. Same is as like nasal prong. Same is the procedure.
You should always wear the gloves according to your
We have
hand
to
size.
wear gloves according to appropriate size. Okay, same is as like nasal prongs. This is the nasal mask. This is the nasal mask. This is the tubing, and this one is exhalation port. This one is exhalation port. This is known as string. This is known as string. Okay, so we have to
String. He is
String.
mentioning string.
we have to connect this one is tubing and this one is connector. We have to connect this with this humidifier. After connecting this tubing with the humidifier, we have to check the oxygen concentration. How we check the oxygen concentration? This is value. This is pressure gauge. This is flow meter. This one is flow meter. Okay. This is humidifier cup, and humidifier cup, it contains distilled water. It contains distilled water, not more than. It should not be maximum. It should not be maximum. Okay. After that, when we on the oxygen cylinder, we have to on this oxygen cylinder. This is we have to on this oxygen cylinder in anti-clockwise direction. Okay. After on this oxygen cylinder, we have to check this oxygen supply on the hand. Okay. After that, we have to put before putting this nasal mask on the face of the client, we have to clean the nostrils by means of swab stick. Okay. After cleaning the nostrils, we are cleaning the nostrils like this one is swab stick. We have to clean the nostrils in circular motion. We have to clean the nostrils in circular motion. After cleaning the nostrils, we are putting the nasal mask on the client's face. Okay.
One more thing, when the patient is regularly having this mask, you have to clean the face. Okay, face wash has to be done, and then only you should use this mask. Otherwise, it will be sticky because of the face oil and everything will be grim is there, so it will be sticky. So always you should clean it, and sweat also will be there because if your mask is completely tucked around the mouth, there will be sweat will be there because of the nose.
After putting the nasal mask, यहाँ पे आप ध्यान रखिएगा. This is very much important, and the nose should be whole covered. Okay, the chin is also should be covered. Okay, after putting the nasal mask and the string, it should be placed behind the ear. Okay. So this is the procedure. We have to provide constant oxygen therapy to the client according to doctor's order. After that, when the oxygen therapy when the oxygen demand of the body of the client is complete, then after that we have to discontinue, or we can say stop this procedure.